Hi friends, I am Dr. Thomas Joseph, consultant physician and diabetologist, Carmel Medical Center, Pala. Today I am going to speak about what are the types of diabetes mellitus. Most common is type 2 diabetes mellitus, as we all know. Almost 90% of the people are affected and 90% of the cases are of type 2 diabetes mellitus. The first one is type 1 diabetes, usually common seen in children. It is an autoimmune disease. The only treatment is insulin. Before the invention of insulin, these children are not getting any treatment and they are dying. Now, after the introduction of insulin by Binding and Best from 1902, that is human recombinant DNA technology, insulin is there. By giving this, these children are lives saved. Type 2 diabetes mellitus is usually seen in obese individuals. They are insulin resistant persons. They are most of the persons are overweight. So the treatment is generally different. They need only oral hypoglycemic drugs. The main drug is tablet metformin. Metformin dosing is different. Usually starts with 500 milligram morning and evening dose. If not controlled by that dose, we will increase the dose to 1 gram morning and evening. Maximum dose per day dose is 2 gram. Metformin has got only minimal side effects. Some patients may complain of gastric intolerance. So in that patients, we can switch over to other group of drugs, mainly sulfonylureas, that is glimepiride, gliptins, the SGLT2 inhibitors like that. So the main focus of treatment in type 2 diabetes is to control sugar and also to decrease the body weight. For that purpose, these two goals are achieved by giving metformin, tablet metformin. Only contraindication is renal if patient's glomerular filtration rate, that is per minute urine output, is decreased below 60 ml per minute, we will decrease the dose. And if it is glomerular filtration rate, estimated glomerular eGFR is below 30 ml, we will stop the metformin. We will switch on to glimepiride or other drugs, SGLT2 inhibitors. So type 2 is the most common. This is the mostly common in middle age, that is about 20-year age group. Mostly in 35, 40, 50-year age group, we are seeing this type 2 diabetes mellitus. The type 1 diabetes usually seen below age 20 in children. The third one is type 3 diabetes, that is pancreatic diabetes. It is usually caused by stones or due to chronic infection, that is chronic pancreatitis. That is causing damage to beta cells of pancreas. So they are deprived of insulin. Insulin is not secreted. Insulin is usually secreted by beta cells of pancreas. These insulin are not secreted by pancreas. So they are getting diabetes in type 3 diabetes. Only treatment you can give is insulin. So most of the patients can be controlled by oral hypoglycemic drugs. The fourth one is gestational diabetes. That is, they are diabetes seen in pregnant patients. Before they are getting pregnant, they are not having diabetes. By 24 to 28 weeks, if you are taking glucose test, they are fasting. If their fasting blood glucose is more than 95, or 2-hour ppbs is more than 120, or 1 hour postprandial blood sugar is more than 140, they will come into the class gestational diabetes. The main focus of gestational diabetes is this diabetes will stop, or there is no need for taking any drug after postpartum period, that is 1 to 1.5 hours post delivery. The other one is that is more monogenic diabetes, that is maturity onset diabetes of the young. This is an autoimmune disease seen in elderly people, that is mostly middle-aged people. The type 1 is also autoimmune seen in children, and the monogenic diabetes MODY, that is seen in elderly people. The treatment is mostly sulfonylureas, that is insulin secretagogues. Drugs. Example is glimepiride, glipizide, glycoside. These type of drugs are usually given. And the last one is usually seen in drug-induced diabetes. If a patient is getting steroid for a long time, they will develop diabetes. So, this blood sugar can be controlled by giving either oral hypoglycemic drug or insulin. This drug-induced diabetes can be reversed, or remission can be obtained after stopping these steroids. These are the main types of diabetes, that is type 1 diabetes. Type 2 diabetes, that is the most common. Then type 3 diabetes, that is pancreatic diabetes. Then type 4, that is the gestational diabetes. And fifth one is MODY, monogenic diabetes. And the sixth one, that is drug-induced diabetes. If you have any queries or any doubts, Please comment or you ask your questions in the chat box. I'm happy to answer to that questions. Thank you.